Honourable Member Calgary Mountain View.
Thank you, Mr. Speaker. Obviously a very critical piece of legislation, in this case in the form of a motion, which was a surprise. But given the realities that we've faced in the last couple of years, and in fact I would echo some of what the Minister has said, the previous government knew that this was coming 3 years ago. I raised it with the former Minister of Health, a couple of former Ministers of Health. They didn't want to touch it. They wanted to wait. The Supreme Court made a decision 18 months ago, still no sign of action in the government of the day. So what we're left with is a federal government that has not done its job in terms of making a timely decision, and a provincial government that is also late in making the decision. And the reality is that Monday, Alberta is going to change with the rest of Canada, and we're all going to be, as the Minister says, the what is clear. Doctor-assisted dying will be a reality. The question is, are we going to have enough guidelines and regulations in place that both the physicians and the patients and their families can be confident that they know what to do, who to contact, how to go through the process, and have confidence that if something goes wrong, there will be something, there will be a process for accountability for the something that might go wrong. What doctors have been doing for all of history is making decisions with their patient about whether assisting them with medical interventions is improving their dying or enhancing their living. That is a decision that every doctor has been making for eons. Do we intervene, and in what way do we intervene? And that is a discussion with every patient that is coming to those difficult end-of-life times. So this is really a question of prolonging living or prolonging the dying process and adding to the suffering of a person that has actually made a conscientious decision to stop the suffering or to stop living, in fact. I was pleased to see these guidelines today, the regulations. That's the part that I think has created a lot of consternation. I too would have loved to see these last week or last month. We got them today. Let me just say that the proposal that will amend the College of Physicians and Surgeons Standard of Practice looks comprehensive in many respects. It deals with the essentials of who can give permission, who can give consent, what qualifications the physician must have. Again, it doesn't indicate a nurse practitioner, and there was a national discussion that nurse practitioners could also be involved with this. That's something we'll have to address at some point in the future. But the essence of these guidelines will require a physician, two physicians in fact, to certify that the person is of sound mind in making a decision conscientiously. The period of time for reflection isn't indicated here, but I can tell you that any physician that I've talked to wants to have a period of time when everything can be reviewed, family and individual, and appropriate health professionals can assure themselves that this is not something that is being made lightly and that there are proper opportunities for the person to reverse their decision. Issues like a medical examiner being involved in these unnatural deaths. Any unnatural deaths are supposed to be referred to the medical examiner to make sure it wasn't murder. Those are part and parcel of the regulations, and an annual review is identified in the regulations, which again gives me some assurance that the review committee, after a year, will look at the process, receive complaints from family members who say it went poorly or it went well, but this could be improved, and as in all cases of legislation and policy, all of us want to see improvements over time. What we know is that the majority of Canadians and Albertans want this support, and they want to have a clear path to get to the destination, which in rare cases will be physician-assisted dying. It may or may not be necessary in this document to specify whether the doctor has to be present at the time of death or whether the doctor can be, just the family can be present and the medication self-administered. I don't see anything here to say whether the doctor's presence is required. The other area that is so critical, I think others have brought this up, is protecting the vulnerable. Who are the vulnerable? They're people who could be coerced, that could be undermined by those in family or in close association who are after their money or after their estate or after their, or want to be relieved of the burden of caring for them. So there has to be some real rigorous attempts by the healthcare team to assess whether there's any degree of coercion on this individual to make a decision that they don't really want, that they're not really wanting doctor-assisted dying. That has to be properly reviewed and assessed. And from everything I've read, you know, people in palliative care, most of us will end up in palliative care in the last weeks or months of life. It's a very small proportion, perhaps 4% of those who are suffering and in the process of dying. Only about 4% actually avail themselves in the areas where they can in the world. Only about 4% of those in terminal stages want assistance in dying. So this is not going to be, I would venture, not going to be a very common event, but it's something that we have to accommodate, not only because of the Supreme Court, but because I think the majority of Albertans and Canadians have said we want more control over the nature and the timing of our death. The final thing I want to say, I guess, and I will be supporting this motion, recognizing that there may be some gaps, there may be some improvements we can make, and that this will be an ongoing process of review. Final thing I want to say is that this can never be an excuse for weak palliative care. We have pockets. We have pockets in this province where there is almost no access to palliative care. We have an unequal system around the province and around the country. So I think it's fair to say that there will be unequal access to palliative care and there will be unequal access to physician-assisted dying. We have to make this as equitable as we can, and in the first instance we have to have top-of-the-line palliative care, which will prevent many requests for doctor-assisted dying. There's no question that if people are suffering mentally or physically or massive indignities because they can't get the proper nursing support for their bodily functions or become so dependent and not getting the supports they need, then they will be more likely to ask for a quick death. Having said that, there are clearly ways that we can support excellent palliative care. There are dedicated professionals whom I know are in palliative care and will not be involved in physician-assisted dying. Their role, their training, their focus entirely is on relieving suffering and helping people to die with dignity as much as possible, but with all the supports that are possible now through the medical system. And it is in fact rare that people would suffer in pain given the current drug regimes that we have. It's rare that people would not have the basic technical and material supports that they need, but it still happens. And I guess I would welcome the Palliative Care Society, palliative care physicians, nurses, to weigh in on this and make sure that we as legislators, the health minister particularly, knows where the problems are in palliative care, and that we do everything possible to ensure that people are not making this choice because it's a default from inadequate palliative care. Yeah, exactly. It is an experience that all of Canada and all of the world struggles with. So with those comments, Mr. Speaker, I will take my seat and look forward to hearing other perspectives on this.